to us on matters financing in the country and, of course, on matters real estate. And we'll also be talking to a reporter in the town studio, that is Noah Kipkemboi, who is in the KTN town studios. But first, let's have a look at the headlines of the business today. Government unveils new express train to Jomo Kenyatta International Airport. Kenyan farm invents teleconferencing mobile application to enhance connectivity for schools. And property market slowly recovering as effects of pandemic subside. All right. And of course, that is what we have for you today, plus much more. But first, let's have a look at the currencies and the capital markets. And now on to our stories today. Now, Kenya's health sector was gearing up for a major paralysis as doctors threatened to go on a strike. But last evening, the Kenya Medical Workers and Dentists Union suspended the strike to negotiate with the Ministry of Health, all in a bid to avert a total lockdown. We are keeping an eye on the cost of the strike as well as what really ails Kenya's health sector. We shall be shortly speaking to reporter Noah Kipkemboi from our city center. But first, let's... okay, Noah, kindly tell us what is the situation like?
Well, thank you very much, Brian George Otieno. The first thing that we have to look at is where we are, the status quo. Over 40 medical doctors and medical practitioners combined have succumbed to COVID-19. 1,500 deaths across the country. These are dire numbers that we have to take a look keenly and see what are the economic repercussions. Now, according to the World Bank, they released a report on global economic prospect for the year 2020 and 2021. And one of the key issues they're looking at are emerging markets and developing economies, where we lie under. How will we survive this issue of COVID? And they said central is the healthcare system. But let's come home. How are we doing as a healthcare system? The issue is about funding. Funding of healthcare in our country, Brian, is divided into two aspects. There's the national part, but healthcare to its core is devolved. Speaking nationally, in the last allocation to the health ministry, we had 1.75 trillion, actually 1.75 trillion shillings were allocated to ministries, departments and agencies. This is, collectively. This was a reduction of 6.8% from the previous financial year of 2019-2020. So already allocations are going down. Then you look at the county allocation, 370, which is the equitable share, also that went down by 2.3%. You ask the connection with matters healthcare, where does it come in? The county government is responsible for making sure that, the primary and secondary healthcare providers are funded and are running. And the national government is to facilitate and equip and also implement the issue of policy. And we've seen recently, actually taking an example of Nairobi County, AAR, which is a medical insurer. They cut ties with Nairobi County, saying that they haven't been paid for the last close to 4 months, and they are owed 855 million. This means that the workers of Nairobi County, over 12,000 of them, have to cater for their own health service. So you see the trickling down effect. The question is, how do we move forward from here? KMPDU, they've said 14 days to negotiate how on the way forward. I think it is very important. But to the core, we have to solve this issue, and it's a matter of proper healthcare funding, but also the equitable share to the counties, making sure that the money is delivered to the counties in time. You saw the other day the governors are complaining, they will shut down the counties if they don't get any monies, because the money is also responsible for paying doctors and whatnot. But secondly, before I finish up, Brian George Otieno, the issue of funding the PPEs, it is quite unfortunate, to say the least, that just recently the government has given the go-ahead to the Kenya Medical Supplies Authority, that is KEMSA, to release the PPEs. This is how many months into this pandemic our doctors are not properly equipped. Some of them have lost their lives in this fight. This is a major call to the Ministry of Health, but also to the government at large. Not only county governments, but the national government to really take a look at themselves and what exactly is happening at some of these issues. Also, 6.3 billion shillings has been released to the NHIF, National Hospital Insurance Fund, to make sure that healthcare providers and also public servants are properly covered. And I think that is very central towards the fight of COVID-19. With that said and done, Brian George, I think as we close up, it's imperative that we take precautions. We are entering the festive season. Kenyans are a little bit reserved. We've seen the tourism sector going up due to local tourists, which is a good thing. But at the same time, this time, the festive season, it's imperative that we be careful. Make sure that you put on your mask, but secondly, all the service providers to make sure also their facilities are properly equipped to cater for Kenyans and keep them safe. Over to you, Brian.
Thank you so much, Noah, for painting that grim picture of the status of the health in the country. And of course, thank you for those details. But now we want to listen to the Secretary General of the Kenyan National Union of Nurses, Seth Panyako, on this same issue.
Expect all our members in the county government and national government to go on strike, which is totaling about 23,000 nurses. We were 26,000, but numbers have come down because of retirement, natural attrition, and those who have left the service. So we have about 23,000 nurses in the national and the county government. And that does not include Kenyatta National Hospital and Moi Teaching and Referral Hospital, because the issues as raised have been addressed to our satisfaction when it comes to Moi Teaching and Referral Hospital boards and Kenyatta National Hospital boards, led by their respective CEOs. So we are looking at about 23,000 nurses, both the national government and the county governments, who are participating in the industrial action. We have a few counties, like 2 or 3, who are set to begin the strike tomorrow because there was certain confusion in terms they had issued their own strike notices on the local issues, and which were falling in place with the national issues. So some of them had confusion, but we have since rectified that, and those about 2 counties or 3 that have not started the strike today, including Meru, will be beginning the strike tomorrow. Government, and they want us to be human. We are human. It is them, wananchi, who are supposed to ask the government to be human, at least to forget this thing of BBI, set it aside, and channel all the necessary resources to fight COVID-19 and address the issues affecting health sector. We're not going to suspend the strike because KMBDU has simply suspended their strike. KMBDU is running health sector. In fact, the Ministry of Health should be called Ministry of Doctors, because as far as we are concerned, one of the problems we have is emanating from the doctors. They are enjoying, when you look at the doctors' allowance, which they are earning, ranges between 60 and 150,000, while nurses are getting 20, which was moved to 30,000, and they have refused to implement that little, that meager being paid to nurses. When you go to AFI House, every department is headed by medical doctors. So basically, they have a CBA. They are the only people in the health sector who have a CBA. So as far as I'm concerned, doctors may not have issues really that may push them to go on strike, because even the risk allowance, they are getting 20,000. Nurses are getting 3,850. So their issues are very unique to themselves. We do not want to bring in the issue of doctors. We are on strike and we're not going back.
Of course.